The mechanism of autoimmune tissue damage can often be determined by adaptive transfer. To classify a disease as autoimmune, one must show that an adaptive immune response to a self-antigen causes the observed pathology. Initially, the demonstration that antibodies against the affected tissue could be detected in the serum of patients suffering from various diseases was taken as evidence that the diseases had an autoimmune basis. However, such autoantibodies are also found when tissue damage is caused by trauma or infection, though these are typically of much lower affinity than those associated with autoimmune disease. This suggests that autoantibodies can result from, rather than be the cause of, tissue damage. Thus, one must show that the observed autoantibodies are pathogenic before classifying a disease as autoimmune. It is often possible to transfer disease to experimental animals through the transfer of autoantibodies, causing pathology similar to that seen in the patient from whom the antibodies were obtained. This does not always work, however, presumably because of species differences in autoantigen structure. Some autoimmune diseases can be transferred from the mother to fetus and are observed in the newborn babies of diseased mothers. When the babies are exposed to immunoglobulin G autoantibodies transferred across the placenta, they will often manifest pathology similar to the mother's. This natural experiment is one of the best proofs that particular autoantibodies exert pathogenic effects. The symptoms of the disease in the newborn typically disappear rapidly as the maternal antibody is catabolized, although they may cause chronic organ injury, such as damage to the heart in babies of mothers with SLE or Sjogren's syndrome. The clearance can be speeded up by a complete exchange of the infant's blood or plasma, though this is of no clinical use after permanent injury has occurred, as in congenital heart block. And that's the mechanism of autoimmune tissue damage can often be determined by adaptive transfer. Have a great day.